Great, today we're gonna go over an arm bar. We're gonna use a kettlebell weight for this exercise. We'll talk about a few cues and different variations that you can add to help push your patient along for whatever they might be experiencing. So for this exercise, if you're wearing a watch, you can always turn that around so that when a kettlebell is on your wrist, that it's not going to hurt the watch or break the watch in any way. We're gonna get into a similar setup just like a Turkish get up. As a provider, you're gonna wanna be on the side of the weight so that you can monitor or guard the weight from falling back out of position and straining the shoulder. So for proper setup, we're gonna start on the side, cradling this weight and rolling onto the back so that as this weight gets heavy, you're gonna get this safely into position. From there, everything is the exact same setup as the Turkish get up. We're gonna straighten out one side. Opposite side is gonna stay bent so you can use that leg to drive off of. Holding this weight up in the sky, you're gonna start with a fist straight up, wrist is neutral, and you're always gonna keep the eyes on the weight. So using that leg to drive over, I'm keeping my eyes on the weight, my arm straight up in the sky, and I can use my arm or my hand to support this weight. From this position, you should see that their belly is getting pretty close to the ground so that they can ensure they're getting as much rotation as possible. In order to position this in the right area, you might have the patient shrug their shoulder up and then back down. And at that point, they might feel some engagement through this lat area. Okay. So from this position, we might go for, say, 15 to 30 seconds to just assess capacity. If they're having a pretty easy time with that, you may need to increase the weight to add a little more challenge, or you may begin to add a little dynamic movement in this position, such as rotations of the shoulder. You'll commonly see patients want to just supinate and pronate the wrist, where they're not getting a lot of rotation at the shoulder. So I like to cue rotate about the elbow, all while keeping that shoulder down away from the ear. Good, once you finish your set, you can roll back, keep that weight straight overhead, lower down, back to the side.